This is my mom. I love to brag about her the way parents brag about their kids. She's a first-generation Guyanese American who's worked extremely hard for everything that she has, and I aspire to be just like her. She's truly one of a kind. But in a more literal sense, as of 2020, she is part of the 2.8% of Black female physicians in the United States. The lack of Black representation in healthcare has become a huge issue in the US. Black people have played a significant role in the field of medical advancement and discovery over the past 200 years, including both medical professionals and those who were subject to unethical experimentation. Yet for being so crucial in the advancement of medicine, they receive subpar healthcare compared to their white counterparts. According to KFF, an independent source for health policy research, Black people had higher health risks associated with COVID-19, with them being 2.5 times more likely to be hospitalized after infection and 1.7 times more likely to die. Yet despite these increased health risks, Black people were less likely to get vaccinated for COVID-19. This is just one of many examples. Today, I'll be diving into these disparities and how we can work together to bridge the gap and further our goal of reaching racial equality in this country. Now, it's hard to fully understand these disparities without going back in time. From the 18th to early 20th century, white physicians studied Black slaves and their descendants. They believed that all health questions could be answered in the body. Thus, if Black people had worse health outcomes than white people, it must be attributable to some innate racial weakness. This research significantly contributed to the construction of harmful racial narratives in the United States, many of which can still be seen in the lives and health of African Americans today. In 1787, a British doctor named Benjamin Moseley claimed that Black people could bear surgical procedures much more than white people. He explained that a surgical procedure that would cause immense pain to a white man, such as a leg amputation, would feel like almost nothing to a Black man. These misconceptions about pain tolerance also allowed physician J. Marion Sims, who was long celebrated as the father of modern gynecology, to use enslaved Black women as subjects in experiments that would be unimaginable today, performing painful procedures at a time when anesthesia was not in use. Moving forward to segregation and Jim Crow, Black Americans still struggled to get the healthcare that they needed, and medical stereotypes continued to exist. During this time, segregated healthcare facilities and hospitals were common. Black people had limited access to healthcare, as many of the available facilities were underfunded and understaffed compared to those serving white populations. Additionally, Jim Crow laws perpetuated economic disparities between white and Black communities. Lower socioeconomic status is strongly correlated with poor health outcomes, as it affects access to healthcare, nutrition, and living conditions. During this time, Henrietta Lacks, an African-American woman born in 1920, unknowingly became a pivotal figure in medical history due to the extraordinary properties of her cells. In 1951, during a routine medical procedure at Johns Hopkins Hospital in Baltimore, Maryland, cells were taken from her cervix without her consent. These cells, known as HeLa cells, were unique in their ability to multiply indefinitely outside the body, leading to numerous medical breakthroughs, such as the development of the polio vaccine, advancements in cancer research, and insights into the effects of radiation and toxins. However, it wasn't until 1975, over 2 decades after her cells were taken, that her family was informed of their existence. This lack of informed consent and acknowledgement of Henrietta Lacks's contributions highlight the historical exploitation of Black bodies in research. Today, beliefs regarding physician mistrust among African Americans are reinforced by inequitable treatment in comparison to white Americans. A recent study has shown that a lack of cultural diversity and competency among physicians has strongly contributed to this widespread uncertainty. Now, with all this in mind, how can we fix this issue that we're having in the healthcare system? It's simple, through representation. We can encourage Black youth to pursue careers in medicine and healthcare. Now, you may be asking yourself, well, how will this help address the issue at hand? Well, let me explain. When Black doctors treat Black patients, their health improves and the mortality rates decrease. This cultural competency fosters a sense of trust and improves doctor-patient communication. According to Provider Solutions in Development, when Black doctors treat Black patients, their health outcomes significantly improve. Moreover, when Black men were treated by Black doctors, they were more likely to follow preventative healthcare measures than those who were visited by white doctors. Additionally, individuals who saw Black doctors received 47% more flu vaccines and 72% more cholesterol screenings. By encouraging Black youth to pursue careers in healthcare, we can increase the number of positive outcomes. I am overjoyed to share that I have been presented with the amazing opportunity to pursue my bachelor's degree at Harvard University in the fall, where I intend to pursue a career in medicine and be the change that I hope to see in the world. As a Black woman myself, I am aware of the underrepresentation of Black professionals in healthcare, as well as the systemic barriers that hinder Black youth from accessing these professions. My upbringing and experiences have instilled in me a strong sense of duty to advocate and serve those who have been historically discriminated against. One organization also dedicated to this goal is Black Men in White Coats. This initiative is committed to increasing the representation of Black men in healthcare through exposure, inspiration, and mentorship. They've partnered with medical schools nationwide to create online documentary videos highlighting the importance of addressing the underrepresentation of Black men in medicine. Additionally, they have partnered with Diverse Medicine Incorporated to create and implement an innovative web-based e-mentoring model. This model facilitates mentorship for pre-medical students across the nation who are facing challenges such as financial constraints, time limitations, and geographic distances. Additionally, this initiative hosts youth summits, which are community-led events designed to connect medical professionals with underrepresented Black youth. These summits educate young teachers, students, parents, and community leaders about the path to becoming a medical professional. As I conclude today, I want to emphasize the importance of supporting initiatives that foster diversity in healthcare. It is crucial that we break down the barriers that hinder Black youth from accessing these professions. My mom's role goes beyond her achievements. She not only serves as a role model to me, but to other Black children who rarely see someone like her in that position. Together, we can create a healthcare system that mirrors the diversity of our society, ensuring equal access, trust, and positive outcomes for all. Thank you.